Hello everyone, welcome to Global Health Tracks and the GHT Educational Network. The purpose of this video overview is to give you an insight into the products that Global Health Tracks distributes. Today we're going to be talking about something that affects up to 75% of the people in this country and around the world, and they don't even know it. We're going to be talking about it, and if you go to the website and just click on the university study, you'll see that a recent study with Rice University told us about this particular issue that we all have from an internal yeast infection standpoint. And what we're going to be doing today is exploring how that happens and what we can do about it, because most people don't know about it. So the first thing we want to do is introduce our guest today, Dr. Gary Shima, head of the Health and Longevity Institute here in Southern California. He's going to be giving us some insight into, from the time we're born, actually, to what happens. And Mr. Rick Morena, who is Director of Production at HSI. So welcome to both of you. Let's get started, Dr. Shima. Is this phenomenon that we see happening with people having all kinds of symptoms of brain fog and being tired and having droopiness and itchy skin has been attributed to a lot of single-cell yeast that invade the body. So tell us a little about that, how it comes about, and then we'll talk about what we can do about it.
Well, let's start at the beginning, Russ. We're all designed and born to be healthy. However, as a fetus or a newborn, our gastrointestinal tracts, our digestive tract, is basically clean and sterile. We need to have what nature intends us to have, we call good bacteria, or these good flora, that aid digestion, keep our immune system strong.
Now, let me just ask you, Dr. Shima, I think a lot of people hear the word bacteria, and you talk about good bacteria, bad bacteria. Kind of explain that for a moment. We need a certain amount of good bacteria, good flora.
Right. The good bacteria are the lactobacillus, the acidophilus, the bifidus. These kind of bacteria are necessary to aid digestion and to keep our bodies healthy and strong. So what we look at is when there's invasions of different strains of bacteria and fungi and yeast, then we start to have an abnormal condition and our health can suffer. Now, if a person is born by a cesarean section, they don't get that benefit of coming through the birth canal. Number two, if they're not breastfed, they don't get the good benefit of these good bacteria. And then with growing in that first year or two of life, there's the common colds and the ear infections, and immediately some antibiotics are used in these infants and newborns and through the first couple of years of life. The antibiotics kill, if you want to talk about the good bacteria that are established in the intestinal tract, and allow for these yeasts, which are around everywhere. We have yeast and fungi and bacteria out in our environment, and they very easily then take up a secondary residence and then compete with this healthy process, and that's what we're going to be expanding on, some of these issues that are taking place.
Right, and some of them that we know are common to everyone, probably in America on occasion at least, is the concept of heartburn, acid reflux, upset stomach. We mentioned a little earlier in the introduction about the droopiness and that type of thing. So we see all kinds of advertising on television and all types of things in the grocery store for these problems. But part of the problem is that we need a certain amount of acid in the stomach. So maybe you can explain the process of digestion, and that bacteria resides down in the intestine. Explain how when we, take our food in, what happens as it goes through the stomach lining.
Right. Now, if we've been established, like we said, from a youth, we had this proper amount of good bacteria there, then our food as we ingest it starts stimulating the stomach to produce enzymes and acid that allows the breakdown of the proteins, especially from the foods we eat, to help rebuild and grow and so on like this. So that starts the first phase of digestion. As the food processes down, it encounters the pancreas with its enzymes that allow further digestion. And with the bacteria properly there, then you get the proper assimilation and everything is very, very healthy. Now, if we had some yeast overgrowth from either these earlier conditions of antibiotics, et cetera, and not getting a good, healthy first start, then what happens is these yeast will compete and actually use some of the foods that we are needing for our own self to cause them to grow and to replicate and keep their process going. They create byproducts, organic chemicals that our body can't use for energy, but can be absorbed from the intestinal tract.
Wow.
And they can produce inflammation, they can produce headache, they can produce allergies, and just a sense of spaciness, brain fog as it's called, and you just don't feel right. and that is just the competition from these abnormal organic chemicals that are produced by the yeast.
Right, and what we know about it is the study points out in several studies that we've researched, is that it's very hard to diagnose. It's very hard to figure out what's going on. I mean, people actually go to a physician like yourself. I'm not feeling well. I feel tired all the time. I have itchy skin or scalp or manifestation of a number of problems. Various tests, can't find anything. And so we call it kind of the missing link to diagnosis. Am I correct in that?
Yes, it's a variety of symptoms or a syndrome, but no clear cut. You can't put your finger on a diagnosis from a blood test or a certain X-ray or something like that.
Rick, in talking about what Dr. Shima's talking about, as I mentioned, you go to the grocery store, you go to the drugstore, and there's all kinds of things you can chew, and they're supposedly going to clear up this. Tell us what this whole concept is and why this product's been so effective versus something that you just take as a liquid or something that you chew.
Well, like Dr. Shima mentioned, what we're dealing with here is we're dealing with live bacteria. So we are dealing with organisms. So if you introduce these into the stomach, we know that whatever comes into the stomach automatically starts to get assimilated and starts to be broken down by the stomach through the acid system that lines our stomach. So if you put these microorganisms into the stomach, they're going to be broken up immediately. And in essence, what we're saying here is that the bacteria is going to die for the most part. Maybe
now we're talking, when you say bacteria, we're talking good
about the
bacteria,
good beneficial organisms that you find in this product. Right. So in order to achieve efficacy from the product, in order to achieve benefit from the product, to obtain this, we need to be able to introduce the organisms, the live bacteria, into the intestinal tract in an intact manner. So the only way to achieve that, you had the product on the palm of your hand here a moment ago, and why don't you open another sachet, because we'd like to bring something out. Is there product left in there? Okay. So what we're looking at here is we're really looking at crystals. Okay, and each one of these crystals contains these organisms that are so essential. So
order, you say the organisms, you're actually talking in suspension.
Exactly.
Right.
Exactly. So each one of these crystals contains literally thousands and thousands of bacteria. So what we have here in the production of this product is a very sophisticated, high-tech process that's called microencapsulation. So each crystal you can look at as a capsule. It's a microcapsule. And we know what normal, regular capsules look like. It's a 00 capsule that you take, like in our enzyme product. That is a capsule. Well, these are capsules too.
Right.
So what actually happens is that each one of these crystals is coated individually.
Wow.
And there's different types of microencapsulation, but the one used here is real, true microencapsulation, because 100% of the crystals have to be coated. Okay, with a lot of less sophisticated microencapsulation methods, maybe 50% get coated. So if you're taking the product and you're expecting benefit from it, well, you're only going to get 50% of what your real expectations are and should be. So this microencapsulation process, the way it works is the crystals are coated with different elements that are all natural, that are not attacked by our stomach acids. Okay, so there is the product does not start to get broken down in the stomach, nor does the stomach start to digest this product. So the idea is that we now push it into the intestine and then finally into the gut where we want it to be, the intestinal tract, in an intact manner. So now, once they're introduced into the intestinal tract, now the bacteria starts to go to work.
Right.
And the way it works is that the beneficial bacteria, of course, needs to feed off of something in order to multiply. So it's feeding off of the harmful bacteria, like Dr. Shima mentioned. We have yeast overgrowth and fungi and different forms of bacteria that are essential in a controlled manner. Once there's an overgrowth of these malignant bacteria, then we have health problems, like we already talked about. So now we introduce the ThreeLac product into the intestinal tract, and now what's happening is, as it's devouring, feeding off the bad bacteria, now it's multiplying. And like Dr. Shima well explains, all the folds in the intestinal in the intestine, now begin to get coated with the beneficial bacteria.
With the good.
So you're chasing out the bad with the good.
Wow.
And this, of course, multiplies tremendously, so we can see the benefit that we get.
Right. Back to Dr. Shima for a moment. ThreeLac from Global Health Tracks comes in these types of packets. And talk a little bit about, Dr. Shima, if you would, sometime that it gets so infected in the intestinal tract, as we mentioned, it can drill in and get into the body, called systemic infection. So from a precaution standpoint, if someone's in that position, and of course we have the instructions on here, but talk a little bit about, from a dosage standpoint, that you want to make sure you don't have a reaction and overkill too quickly if you have a systemic infection.
Right. So we talked about ThreeLac having the ability, those bacteria, when they're released, to actually work against and actually kill the yeast itself there. When the yeast die off, it's called a detox or a die-off reaction. If that happens too quickly, the byproducts of that yeast can be assimilated to the body, and you can have excessive headaches, maybe more muscle aches, just feel real fatigued and languished and so on. So you can control that reaction by testing it out with a packet or two, packet once and then maybe another one in the other part of the day, and see how you feel within a day or so. Mm-hmm. If you're not having those reactions, then you can progress on to the therapeutic recommended dosages, which can be up to 1-3 times a day, or even 1, 2, 3, 4 times a day to treat depending on the symptoms.
Right. Now, in addition, in your practice of anti-aging and longevity, tell us about the testing. You can actually do a blood test to find out if you have Candida. Is that correct?
Yes. Majority of the diagnosis, if you're suspecting it, can be made by the symptoms that people give you and so on. But if there's a confirmatory test you'd like to really see, and some people want to have that done, you can do a blood test. And you can do these Candida antibodies, and they test for IgA, IgG, and IgM antibodies for the Candida. IgA antibodies measure we call the first line of defense antibodies, which are coating antibodies that our body is producing to resist the yeast right at the surface level. And if you have positive IgA levels, you probably know you do have Candida, at least in your gut, circulating around there. How extensive, we don't know. IgG measures any long-term exposure that you may have had over the years. So it's not going to tell if it's current or not, but if you had any exposure or excessive yeast, you'll have higher levels of IgG antibodies. And then the IgM antibodies are the markers of recent infection. The body's really responding in something currently, and especially if it's more severe, you'll have a higher IgM antibody. And then they do a Candida antigen, which is measuring the actual proteins of that yeast in your blood. And again, if that's, like you say, more systemic, and this is full systemic becomes rare to people that have very poor immune systems, right. People undergoing cancer, chemotherapy, someone who's maybe an AIDS patient that has the immune system totally wiped out. They're very susceptible to having the Candida just flourish through the blood and end up in the brain in different areas and so on. So most people that have generally fairly good immune systems can just be at that early stage of maybe just showing it at the membrane starting to go through and so on. So it effectively can be treated with a product like ThreeLac.
Now, a short way to find out, and a simple, free way, easy way at home, is we have posted right here on our website for everyone a saliva test. And you just wake up in the morning with the clear glass, deposit that first morning saliva. If it has the little strings in it, that's all explained on the website. But tell us why that has some credibility, the purpose of why it may sink down, and that is an indication that you may have some type of internal yeast infection.
Right. It's a good screening test for checking the degree of Candida, and also following your own progress when you're taking some treatments to see if this test actually changes. So basically, people that have, quote, normal bacteria in the intestinal tract with very little, small percentage of yeast, and their digestions are working well, if you would deposit the saliva on the top of that glass, it will just disperse and maybe bubble and just kind of float and undulate, and that's all you see. When there's more Candida, and it has probably to do with, we don't know the exact mechanism, but probably to do with some antibody formation and some changes through chemistry of the saliva when the yeast is there, present, that you begin to see this globular nature, this thickening, this precipitate is the word that's used, and actually a white cloudy strandy, stringy material will start sinking to the bottom. The more prominent that is and the quicker it happens is probably the more yeast that you have. And then as it clears, it becomes less and less until you almost, if you get to normal, it just kind of floats and stays on the top.
Right. So as a preliminary, if the saliva sinks or has the strings, get going on the ThreeLac and then retest the saliva every, 2-3 weeks, every month?
It's a simple, non-invasive test, and it's a good monitoring mechanism.
Okay, appreciate both of you being here. There you have it, ladies and gentlemen. ThreeLac, a tremendous, tremendous product that's gotten great results from people who have all these different symptoms that we talk about. So we encourage you to explore the website, look at all the documentation, all the studies, all the articles, all the backup, and take that free and easy saliva test yourself. And make sure that you have that wonderful bacteria working for you. If not, try the ThreeLac, and it's an easy thing to monitor at home. Doesn't cost anything. And as always, thanks for being here, and always have a super day.